So you have a painful shoulder, you're worried about it, people have told you it could be a frozen shoulder, you don't know what to do. Well, I'm going to tell you about impingement. First of all, symptom-wise, impingement problems tend to be over 90 degrees. So if you lift your arm up to 90 degrees and below that it tends to be okay, then that would be an indication that it's an impingement problem. So when you lift up your arm, it's painful, and if you can go further, it continues to be painful. And sometimes even you can get your arm fully up, yeah, the pain can sometimes go away. But often it's painful really from 90 degrees all the way to the end of range. It can be in that direction, and it often is in this direction. So one of the other key variables with this type of problem, impingement, is that the pain is often felt down the upper arm. So if pain is predominantly experienced above the shoulder or into the shoulder there, in that distribution, then it doesn't tend to be an impingement problem. We tend to feel impingement problems in the upper arm aspect. So if you think you've got impingement, what is going on? Well, here I have a shoulder joint, and the shoulder joint is a very complex joint because it has the shoulder blade itself, the ball and socket, and a vast array of range of movement that the shoulder can move in. And that is controlled by what we call the rotator cuff tendons. Now, what we have here is a right shoulder with the rotator cuff surrounding the ball and socket. There is one on the top, one on the front, and two at the back. So those are the rotator cuff surrounding that ball and socket and causing the shoulder to be stable. Now, what can happen when things go wrong is if you have a strain to one of these tendons, when you lift your arm up, and hopefully you can see that okay, it pinches against the underside of the bony prominence there of the shoulder blade and causes it to be painful. And that's why when you lift up to that 90-degree mark, that's when it's acutely painful. Before that, it doesn't tend to be very painful at all. It's when we get up to that range. Same goes for at the front as well. When we lift up, the impingement is caused, so that pinching effect, irritation to the tendon. So very easy to diagnose really, because if you have pain and restriction above 90 degrees and it's quite sharp above 90 degrees without pain in this distribution down here, and certainly if you're taking your arm forwards, outwards and inwards, and that's okay, it would be a real indication that there's impingement there. So I guess what you want to know now is what you do about it. Now, if someone comes into clinic and sees me with a diagnosed impingement, and I confirm that, the first thing that they get advised to do is to avoid as far as is possible the movements which are painful. So it's that old thing, you know, if it hurts when you do that, don't do it. Well, actually in terms of impingement, that's true. In everyday life, it's quite difficult sometimes to avoid movements over 90 degrees completely, but as far as is possible, we need to try and avoid that, whilst at the same time trying to keep moving in the ranges of movement that are comfortable. So that means when we're taking the arm out to the side, we may be just swinging the arm gently side to side, but it's not pinching, it's not causing that pain, because really every time we lift above 90 degrees and it pinches, actually it's irritating the problem. We don't want to do that, we want it to settle down. So we don't want to do lots of exercises that really load it or stretch it when the impingement is concerned, because it will continuously irritate. And believe me, these sort of problems can go on for months, sometimes years. I have people come to the clinic and they have just adapted their behaviour so that they avoid those positions that are painful. We don't want to do that. We want to get back to normal as quickly as possible. And so we want to let it settle down, avoiding those positions, but crucially keeping the shoulder moving. Because if we avoid it completely and immobilise that shoulder, we're in danger of developing a frozen shoulder. So it's movement within pain-free range, or relatively pain-free range, and avoidance of those positions which are really painful. So other potential forms of treatment that we can do, topical rubs. I'm not going to recommend a particular type of rub, although I use a particular essential oil on the tendon itself, but we can rub that tendon around the area of the shoulder there, and that can help promote circulation to it, providing it's not done too hard that causes it to be irritated. Then that's a good thing to do. When to see a physio. If you've tried to avoid those positions which are painful, you've tried to let it settle down, but you've kept moving, you've maybe rubbed on some topical ointments, possibly even some painkillers prescribed by your doctor, nothing's getting better, well, it's time to see a physio. A physio is going to help you to diagnose the problem, confirm the movement restrictions, which are the key ones, and start to do some soft tissue work and massage work specifically on the area that allows you to then get the problem settled down. So if you've done those things from the first part of the video that I told you to do, avoidance and keeping moving in pain-free range, giving it a few days to try and settle it down, and it's not responding, then a really good idea is to see a physio to help you to get it to respond. The key thing is that as we get better, we actually start to be able to lift the arm a bit further before pain. So we kind of chase the pain. So when we start off, it's painful there. As it starts to get a little bit better, we go up to there and it's pain at the end of range, and then all the way up to the end of range where we have a little bit of stiffness and pain, and then finally no pain at all. That's the sort of progressions that we're looking for. So if you're not progressing, I'd urge you with this sort of problem to see a specialist physiotherapist, because if you don't, there's every chance that this can continue for several weeks, even months. Great, you're feeling a bit better, the soreness is settled down a little bit more. It's still painful as you get up into higher ranges of movement, but crucially, it's improving. Well, the next phase is to try and add a little bit of load to the tendons to get them to respond. So first of all, we can do some isometric movements, which is taking the arm to your side, pushing into either your own hand or possibly even a door frame, and pushing and holding for 5 seconds, and then relax and repeat that 10 times. Now that should not increase any symptoms at all. And that really goes for these developing exercises now, that you don't want to put back the work that you've already done in helping it to settle down by over-exercising and causing it to be too sore again. But providing it's okay, which it should be, we're actually just pushing and doing those movements 5 seconds, 10 times. And then also we can get some TheraBand. And just taking the arm out to the side with the TheraBand. Again, the arm is down by the side, crucially. We're going to avoid that pinching position, but at the same time, with some increased load, we're going to get some response from the tendon, which is going to help us to improve the quality of the tendon and therefore get it better. And this exercise should not increase the pain, folks. And if you don't have some of this, you can purchase it from my website, my actual clinic website, on the link next.